Hi, welcome to our presentation on mastering the H&P before residency, tips, pitfalls, and examples. In this presentation, the goals are to develop a systemic approach to note writing, identify key elements of the H&P, and describe common pitfalls when writing the H&P. We're going to begin with the history of present illness, or the HPI. Your HPI is supposed to tell the story of the development of your patient's current illness. If you have a patient with a complex HPI, you might find it challenging to know where to start writing. Try to start by organizing the story in chronological order. You'll want to open with a one-liner, which gives the patient's age, sex, pertinent past medical history, and the chief complaint. For example, you can say, Sally is a 2-year-old female with a history of allergies and severe eczema who presents with fever, difficulty breathing, and wheezing. You'll want to start your story at the onset of symptoms. For example, Sally was in her usual state of health until 3 days ago. Then, describe the evolution of symptoms in chronological order. Characterize the symptoms, describe any attempted interventions, include modifying factors and pertinent positives and negatives, and mention prior lab results and imaging. Remember that you'll want to include other history here if it's pertinent to the diagnosis. For example, for Sally, you may want to mention her history of severe eczema and her mother and father's history of asthma. You might also want to mention the smoke, carpet, and dog exposures that she has at home. For one suggested approach to chronologically organizing a complex HPI, look up the following article, Reassessing the HPI, the Chronology of Present Illness. Here you can see a table from the article that gives you an example of how to chronologically organize a patient's complex HPI. Pause here to read an example of an HPI. A common mistake that people make when writing the HPI is forgetting to include all of the relevant information. For instance, I often notice HPIs that lack the emergency department course. Remember, your HPI should include all of the key information that the care team is going to need to understand the primary problems and the differential diagnosis. Next, let's take a look at the review of systems. Your note should include a detailed review of systems that's relevant to the chief complaint and the history of present illness. Luckily, nowadays, most electronic medical records include a handy ROS that you can click through. When it comes to the review of systems, there are two main pitfalls: not doing enough or doing too much. You might hear that the ROS is not needed for billing anymore. While that may be true, it's still important to document which questions you discussed with the patient and family, because this information is critical to the differential diagnosis. For example, if you have a female teenage patient with headaches, you should review whether she has fever, fatigue, dizziness, decreased activity, eye pain, photophobia, nausea, vomiting, etc., etc. If you go through all of this with the patient, it's then important to document the answers to these questions so that other members of the care team have this information. On the flip side, while it's convenient that most EMRs include the ROS, be wary of accidentally checking boxes or filling in systems for questions you did not ask. Only include ROS that you personally discussed with the patient and family. Next, we'll take a look at the past history. Your past history should include all relevant medical, surgical, hospitalization, immunization, birth, developmental, diet, social, and family history. Note that in the Sunrise EMR, there are multiple convenient checkboxes that can help you fill this section out. including one that automatically fills in previous Phoenix Children's inpatient visits. Pause here to take a look at an example of a past history for a 7-year-old girl being admitted with asthma. The most common pitfall is not including all of the relevant information. It's not adequate for you to write non-contributory for a section or to leave sections blank. Let's take a closer look at this example of a past history that lacks key details. Compare it to the example we looked at 2 slides ago for the same patient. You may find it hard to go back 2 slides in this video, so the PowerPoint with the slides has been provided for you separately. Think about how the additional details are pertinent and whether they might inform your care plan for the patient with asthma. For example, maybe you would consider offering the family influenza vaccination prior to discharge, or offer tobacco cessation resources for the grandmother. Now we'll move on to the physical examination. Your physical examination will include vital signs, a general description of the patient, such as patient appearance, any notable features that they have, comfort versus distress, toxic versus non-toxic, and a thorough report of various body systems, such as head, ears, eyes, nose, throat, neck, cardiovascular, etc. Focus in on systems that are related to the reason for presentation. For instance, include a detailed neurological exam for a patient who comes in with altered mental status, and a detailed respiratory exam for a patient with asthma. Lastly, remember that in pediatrics, growth is the 5th vital sign. Don't forget to look at the growth chart and make a note of whether the height and weight are appropriate for age and what the overall growth trend has been. You can pause here to look at an example of a physical examination for a baby with bronchiolitis. Be cautious when you're using pre-filled templates. Make sure you look through the template and edit it to ensure that your documentation is accurate. Fill in any blanks and delete any portions of the exam that you did not personally complete. Take a look at the physical exam documented on this slide and compare it to the one on the previous slide. Again, it may be difficult to pause this video, so refer to the supplemental slide deck. What differences can you spot? Let's look at the 2 physical exams together now, side by side. The one on the right-hand side is the corrected physical exam. So if you take a look at it and compare it to the one on the left, you can see that in the one on the left, they forgot to fill in portions of the exam, such as their general assessment. Then on the one on the right, there's a much more detailed lung exam, which is important for this patient with bronchiolitis. And lastly, the writer of the exam on the right did not include GU and lymph because they did not do that portion of the exam. Now let's take a look at the next portion of the note: medications, allergies, labs, and images. As the name suggests, in this section, you're going to want to add all of the pertinent medications, allergies, labs, and imaging. Many electronic medical records will fill in some of this information automatically. You'll want to read through it to ensure that it's all accurate. Many electronic medical records will allow you to select which lab results to include in the note. Select the results that are relevant to the differential diagnosis. It is so important to avoid note bloat. If the patient has had an extensive workup, really consider which results are important to include here. Do not just copy and paste pages of results. Notice how in the example here, all of the recent labs and imaging were indiscriminately pasted into the note, leading to pages and pages of information to scroll through. Now it's time to get to the meat of the note and my personal favorite part, the assessment and plan. The assessment and plan are the most important elements of your note. This is the part of the note that other providers are most likely to read. This is where you explain who the patient is, how they're doing, what you think is going on, what you plan to do, and why you want to do it. Start your assessment with a summary of the patient's age, sex, and active problems, including any key context for those problems, such as past medical history, key exam and lab findings, and imaging. Identify the most likely diagnoses, and then discuss how the evidence supports or contradicts those diagnoses. Commit to which diagnosis you think is most likely, and then conclude with an overall evaluation of the patient's clinical state. Go through the next few slides to look at some examples of assessments. This first one is for a febrile neonate. This next example is for a 3-month-old patient who came in with concern for Kawasaki. And lastly, take a look at this example for a 1-year-old who came in with RSV bronchiolitis. One of the most common errors in the assessment is not actually giving an assessment of the patient, and instead simply writing why they're admitted. Remember, this is the part of the note where you have the chance to explain your thinking, so use it. Discuss what you think is going on with the patient and how they're doing. Another error is getting into the details of the plan in the assessment. You can write why your patient necessitates hospital admission, but you're going to have to write the rest of the plan below, so there's no reason to duplicate work and write it here. Compare the examples on this slide to the assessments you looked at in the previous slides for the same patients. Think about which assessments you might find more helpful if you were reading the note as a cross-covering provider who's not familiar with this patient. Let's take a look at one of the assessments together. If you're admitting a 1-year-old with bronchiolitis, then for your assessment, sure, you can say that they're a 1-year-old with bronchiolitis. However, if they have a history of things like wheezing-associated respiratory infections, eczema, allergies, family history of asthma, then those things might impact your approach to the patient, so they would be important to include. Also, it might be helpful to explain why you are not thinking about other diagnoses, such as asthma or pneumonia. And then lastly, you'll want to assess how the patient is doing and say, do you think that they require admission? Do you think that they look ill? Do you think that they look well? Things like that. All right, anyone who's been asleep this whole time, it's time to wake up because we are in the home stretch and the most important part, your plan. You can divide up your plan by systems, such as respiratory, cardiac, endocrine, or by problem, such as acute hypoxic respiratory failure, tachycardia, hypoglycemia. In the Phoenix Children's Residency Program, you'll notice that most residents divide their plan by systems, so that's what we're going to review here. However, either method is acceptable. When you write your plan, include all of the relevant systems and write a problem list under each system. List all of the active medical problems in order of importance. Then, for each problem, state your diagnostic plan, or how you plan to evaluate each problem, your therapeutic plan, which is how you plan to treat each problem, and your consultative plan, that is, which specialties you're consulting and the reason for consultation. Also include any plans for patient education, patient and family social challenges, and plans for social support, patient values and preferences, and any considerations of the risks and benefits to the patient. You can pause here to look at an example of a plan for a 6-month-old girl who's admitted with acute hypoxic respiratory failure in the setting of RSV bronchiolitis with a superimposed bacterial pneumonia. When writing up a plan, don't write a problem without having a plan for it. Also, do not use the plan as a way to write the hospital course or record facts. Avoid abbreviations whenever you can. List the problems in order of importance, and remember to include all relevant details, such as dosing and contingency plans. However, remember that while you do want to be detailed, you should avoid unnecessary note bloat. If the patient has a complicated and extensive plan, think carefully about what information to include and how to best organize it so that it will be comprehensible to other providers. Compare this plan to the one that we just looked at for the same patient. What pitfalls can you spot here? Let's compare these two plans side by side now. When I look at the top left versus the bottom right plan, the first thing that stands out to me is the differences in length. Of course, you want to avoid note bloat. So initially, it may seem like the bottom right plan is the better one. But when we take a closer look, we can see that's not the case. First off, when we're thinking about this patient, this is a patient with RSV bronchiolitis and superimposed bacterial pneumonia. So to me, the most important systems that we want to address for this patient are the respiratory and infectious disease systems. However, in this bottom right note, the first two systems mentioned are cardiology and neurology. And so by the time we get to the meat of the plan, we may have lost our reader already. And then when we take a look at those cardiology and neurology sections, they don't really tell us much that's important in the care of this patient. They're saying they're hemodynamically stable and we're going to monitor their vitals per protocol. Well, that's not really saying much. In comparison, let's look back at the top left plan. There is a lot more text, yes, but this text is really helpful in figuring out how we're going to care for this patient. So we know that the patient lives at elevation. That may change our plans when it comes to discharge. We know that the team talked with the mom about some concern for allergies to amoxicillin, and they explained their thinking of why they wanted to do a trial of amoxicillin. So that's very helpful for everyone taking care of the patient to know. And lastly, they've included some important social information about the family. One last thing that would be helpful to include in your note is the disposition. The disposition can be included at the bottom of your plan along with other social information. The disposition tells the care team what the goals are to get the patient home, or if the patient is not going home with family, what plans are to leave the hospital. Here are some examples of dispositions. If you stuck through the video this long, thank you. If you have any questions, comments, or suggestions on how to improve this presentation, you can email me at akushner@phoenixchildrens.com.